Yep, it's that time of year again. Time to break out the Theraflu and the tissues and settle in for a rough couple weeks. Yes, I'm talking about the flu. So what is swine flu? Wikipedia defines swine flu as an infection by any one of several types of the swine influenza virus. As of 2009, the known swine influenza virus strains include influenza C and the subtypes of influenza A, known as H1N1, H1N2, H2N3, H3N1, and H3N2. Flu-like symptoms started emerging in 1918, but it wasn't until the 1990s when a whole new list of strains started emerging. Since that time, there have been many outbreaks all over. The 2010 Northern Ireland outbreak was the most recent, and it took a death toll of 14. Between 1918 and 2010, there have been a whole list of outbreaks, including the 1976 U.S. outbreak, the 1988 zoonosis, which killed a pregnant woman, but her husband and baby survived, the 1998 U.S. outbreak in pigs, and the 2007 Philippine outbreak in pigs. The swine flu virus mainly affects pigs, hence swine flu. So why does it infect humans? Well, the swine flu virus strain is a combination of the pig, bird, and human influenza viruses, therefore able to react among each other. Direct transmission is also possible. This is called zoonotic swine flu. Since 1958, there have been 50 reported cases of zoonotic swine flu, with 6 resulting in death. The symptoms of swine flu are often the same in pigs as in humans, i.e. fever, lethargy, runny nose, cough, diarrhea, but the swine flu virus mainly affects pigs, so there are a few additional symptoms that pigs get rather than humans, such as difficulty breathing, weight loss, lack of appetite, and poor growth rate. So, think you have the swine flu? Well, swine flu is only able to be diagnosed through lab work when you go to the doctor and they diagnose you. So what are the differences between swine flu and seasonal flu? Because the symptoms are similar, it's hard to distinguish the difference between swine flu and seasonal flu unless you're diagnosed by a doctor. But 2 symptoms that can be factors in maybe telling the difference is swine flu has the additional symptoms of diarrhea and vomiting. And now for the good news. Most people can recover on their own. with just relaxing for a few days and taking Theraflu or some other over-the-counter drugs. But why let it get that far in the first place? Why not prevent it? You can do this by washing your hands frequently. Keep your hands away from your mouth. Wear a face mask if you're going to be around people who are displaying flu-like symptoms. And get your yearly flu shot and use my best friend hand sanitizer. But on the downside, if you happen to get the flu, you can make sure that you keep yourself healthy, rest well, and keep away from people for at least 7 days after your symptoms have begun to ensure that your body gets its much-needed rest and that you don't spread the flu to others. And don't worry, the recovery rate of swine flu is very similar to seasonal flu, about 99%. So sit back, stock up on Theraflu, tissues, and hand sanitizer, and get better soon.